Since we are still currently in a pandemic, and I know Toronto restrictions have been a little bit looser recently, but most of us are still doing school online. We were wondering if you experienced any challenges during this pandemic, especially since you're still responsible for attending labs and practicals.
Yeah, it's been a very difficult year, and unlike anything I had imagined when I accepted my offer to start dental school at U of T. So, how dental school really works is you are basically at school from 8 to 5 every single day, and you have a mixture of labs, in-person lectures, and you have like an hour or two for lunch. But you basically stay together for the entire day. But what happened this year is because of the COVID restrictions, where you can't have more than a certain number of people in an enclosed space, it was a little different. So technically, we can have 96 people or 100 up to 100 people in our lab where we get our preclinical training, but because of the restrictions, we've been going back and forth between 10 or 50. So our lab time was significantly reduced to the point that we had to do this 2 month lab boot camp that I'm completing right now. So obviously, like, it's reduced number of sessions. You have less opportunities to practice those skills, fine motor skills or different procedures that we're learning on our mannequin heads. And it's challenging in that way. And the other way is that it's also a little bit more difficult to connect with other classmates who are going through the same process. And the fact that we started during the pandemic, we didn't really have those connections or like that social support. And I think that was another challenge that I faced. Um, the other thing too that I personally struggled with was the disconnect between what I was learning in my lectures versus what I was doing in the lab. So how things are normally done is you learn the theory behind doing a certain procedure in class, and then you go to the lab and you do it hands-on. So it just reinforces the learning. But a lot of this work that we're doing right now, we learned it back in like February. So that has been a challenge because I have to like go back and forth and like review the material so I know what I'm doing in the lab. But in a way, it's also reinforcing those concepts so I remember it over the long term, which is great for my future patients. Um, I think in terms of like the experience overall, I think the school has been very flexible, accommodating, and very quick to adapt because um, with a lot of like pandemic related gathering limit changes, like they're also very quick and last minute changes. And sometimes things change overnight. So the school has been very responsive to those changes. And I'm glad because we are able to accommodate to changing environments and change the way we do things in the lab. So I'm really appreciative, and I do think that my class is probably going to be like we're learning this skill of how to be adaptable and accommodate like extenuating circumstances, which I think will be very valuable when we enter clinics and graduate.
Just curious, like I know U of T does like this thing called interprofessional education, where like people of like all healthcare aspects come together and like solve case studies. Like, are you guys still doing that right now?
Yeah, I did a few last year or last term, but they're all on Zoom. So it's not the same anymore. But I did meet a few medical students, physiotherapy students through the courses that I did, but it's just all on Zoom, and you can't have that like interactive experience. But I think it's just
Mhm.
it is how it is.
It's got to be tough mediating those personal experiences over Zoom. I can tell you for sure. I haven't seen Theo or Celia in person, and speculating about our height differences and how we're going to be in person is something. But in terms of intersections, like you spoke a bit about how public health and dentistry intersect, but how are you going to plan on balancing those two in the future in your profession? How do you think?
That's a very great question, and I think also a prompt for me to consider as I move through my dental training. So I walked into dentistry thinking that I am going to do public health and oral health. And over time, I was still, so during my master's, I did a lot of research in water, sanitation, and hygiene in different parts of the world, menstrual hygiene management. And when you think about why is Zoha doing dentistry and why is her research on water, sanitation, and hygiene and menstrual health, like there's that, like it doesn't make sense because you would think that a dentist would do research in dentistry. So early on, I really tried to convince myself to let go of my interests that are outside of oral health and say that, you know what, maybe it's time for me to move on from WASH and menstrual hygiene management research and really, explore oral health. And then I reached this point where I thought, you know what, I don't need to fit anybody else's expectation of me. If I like doing research in water, sanitation, and hygiene and menstrual health, I'm going to do that. And I'm also going to be a dentist because I want to be a dentist. So I let go of that expectation, which probably I had of myself, that I need to like merge the two interests that I have. But now I've come to terms with the fact that I can have two totally different interests, and that's totally fine, because when I get tired of like the clinical dentistry part, I can like jump to my research. If I'm tired of my research, I can jump to the clinical dentistry part. So I think at this point it's just too early because I'm still in the process of exploring research on a public health level looks like and whether it aligns with my interests. And again, like I mentioned, I'm a generalist, so for me, it's probably going to be a bunch of different topics that I like love exploring as opposed to just one topic. But I think at the end of the day, I know that I want to do a lot of work, whether it's research or advocacy on the international level. So thinking about the international development agenda and universal health coverage, both of them currently do not have oral health or menstrual health represented. There's a lot of work to be done on a global scale. And the thing with doing a lot of work in international development and globally is that the trickle down effects are seen on the national and provincial levels as well. So I'm really hoping to have some sort of impact, hopefully by the end of my career at that level. And if not, that's okay too. But I think that's what I'm striving for.
Honestly, I think that's a common theme between many students. Like we're all juggling between different interests, different things we want to do, and we're just finding our way as we go. So I feel like it's normal. To switch gears, we'll jump right into some of our more dentistry related questions. So recent studies have shown that the pandemic has resulted in a decline of patients visiting their dentist and overall completing oral health checkups. How can we work towards improving public knowledge about the importance of regular dental checks?
Again, I love this question too, because it really made me sit down and think of my role as the future oral health care provider and what I can do with what's within my capacity to change behaviors. And once I sat down and thought about it, it reminded me of some of the readings that I did for my dental public health course in the past semester or past 1 year. I think there's two sides to the whole situation of patients not going to their dentists. One of them is individual factor, which is I don't want to go to the dentist because I just don't want to go to the dentist. Right? And the other side of that is more of a social or policy level barrier, which is I don't want to go to the dentist because I just don't have money to go to the dentist, or I want to be able to buy groceries during the last week of the month when things are very tight. There are two different sides, and maybe we can like talk briefly about both of them based on like what I know so far from like looking at access to oral health. That's like a problem that shows up at the policy level too, where you're thinking, is oral health an individual problem, or is it an individual responsibility, or is oral health a social responsibility and should be funded by the government or should be covered by the government, like we have OHIP, which is for our medical care. So I think it's important to understand that there's two sides to it. One is on a micro level, the other one's on a macro scale. When we're talking about like micro level, so when I have a patient sitting in front of me who I know is that has like a good socioeconomic status and doesn't have like any financial or access barriers, but a lot of it is like individual motivation, I think it's very important to understand and explain it to the patient too, that there are risks associated with poor oral health. And it's not just about like the links that we've seen between diabetes and periodontal disease and diabetes and cardiovascular health. It's also the aesthetic problem, right? So if a patient isn't brushing their teeth properly, they're going to get caries. And if they get caries, they're going to get them filled up. And when they smile, people are going to see that they got, like if they get amalgam, which is like the metallic filling, if they get that done, then people are going to see their smile. It's going to affect their social life too. So understanding not just the system or physical health aspects or the physical health consequences of poor oral health, but also the social / mental health outcomes associated with poor oral health. Understanding those and explaining them to the patient is important. Also, I was just curious because I thought there's probably like some research out there that has explored something like this previously, because behavior change is so common in healthcare. Like you have a patient coming in with diabetes and you want them to like stop taking too much sugar or like exercising more. How do you get the patient to change their behavior? And I think that is a very important research topic in healthcare overall or public health overall. So I came across like different models, which I thought were pretty cool. There is a few studies done that explored CBT, which is cognitive behavioral therapy. A version of that is called acceptance and commitment therapy to address high dental caries levels. And then another one was capability, opportunity, motivation, and behavior change model to increase adherence to oral hygiene behaviors. And there's like proper research done on behavior change where people are finding the motivation from within rather than telling them that, hey, if you don't brush your teeth, if you don't floss, XYZ is going to happen. You are helping the patient come up with like internal drive to actually adhere to those oral hygiene behaviors. I thought that was pretty cool research. So that's like micro level, like your patient just doesn't want to brush or doesn't want to floss or doesn't want to go to the dentist for regular checkup. The flip side of that is the policy level, which is something that I'm personally very passionate about, because I think a lot of us, so we are placed in different levels within a system. And a lot of times you would think that why isn't that person making better choices when that person's hands are actually tied? So working poor in Canada, the ones that are not given any sort of insurance from their employer and are not poor enough to qualify for the government subsidized programs, those are the ones that are falling through the cracks, right? Those are the ones who, if they get like dental pain and need to get a root canal done, I can't go and tell them, hey, you need to get a root canal done when I know that this person cannot afford a root canal and they need to either pick between buying groceries or buying their kids whatever they need to go to school and getting a root canal. So it's very important to consider what kind of context a patient is in, and then you decide what kind of motivational or behavioral change you want to encourage your patient to go through. So I know I just went on, but I think it's very important to consider that poor oral health is not just individual responsibility. Always remember there's like social determinants of oral health that play a huge impact as well.